that a man was able to impregnate his wife in the first year doesn't mean that he can impregnate the wife in the next 3 years. So it's a couple thing. Subfertility, infertility is a couple thing and should always be a couple thing. And for men, the same thing. The funny thing about it is that many men have this silent infection that block their spermatic cord. The spermatic cord is what carries the sperm to the penis that will help it to be released during sexual intercourse. So a lot of a man can take an infection from any sexual partner, and sometimes it show, like in gonorrhea, it will show. So the man will know that something is coming out from the tip of my penis, and this might be infection, and go and treat. Now sometimes if it's chlamydia, it doesn't show. And chlamydia is very dangerous. It's worse on tubes than any tiny tube like the spermatic cord, and it will just block the spermatic cord. So for men, one cause of infertility is blockage of the spermatic cord, such that sperm cannot come out. Even if sperm, what looks like sperm come out, the real sperm itself is not called. It's just water. Let me use that word now. It's colloquial. You say they release now. They release, but what you are releasing is not the substance.
Yes.
It's not the substance you are releasing. You are just releasing fluid. But people will not know. The substance is very tiny, so you don't see it with mere eyes. So the tubes, the spermatic cord can be blocked that way, and then there's what called oligospermia. You are producing sperm, but it's not enough. It's so small that it is not enough to fertilize the woman's egg. Then you also having what we call varicocele. Varicocele is very common among men. Varicocele means that there are veins around the sperm, around the testes, what we call the balls. There are veins in that area. Those veins help to keep the sperm a little warm. Now, sometimes these veins can be engorged, dilated, and then as they are dilated, the blood is accumulating there. It now keeps the place. The God so designed the testes that he brought it out. The balls, that's is that the term men use balls now? That's what I think they use. So God so designed the balls that they are outside the body, so that inside the body is warm. The balls cannot stand the heat inside the body. So God designed it to be out so that it can maintain that natural temperature, and then the place can be okay to produce sperm. Now, when those veins are engorged, they carry hot blood and stay there. So the sperm is now altered because the temperature around that region is higher than what it should be. So varicocele is a cause of infertility among men and can be corrected. So a lot of men can have varicocele without knowing until they come to the hospital. Then we talk about the different abnormalities that happen with sperm, and those are because sometimes they cannot produce well for no reason. Why some is because of congenital abnormality. That's how you were born. Like those people that have cystic fibrosis, they don't know, but it's how they were born. So those people may not be able to have adequate sperm production that will lead to fertility. But infection is a background. Apart from this varicocele, low sperm count, infection is the background of all this thing. Then both of them, that means a man can have issue, the woman can have issue, and then they both get married and they are not able to have children. Why? In 10% of cases, nobody has any issue, but unfortunately, they can't achieve pregnancy.
Premarital fertility testing. When couples are about to get married, churches usually send them to go do this test. Some people, even after doing the test, they get married, they still have problems later with conceiving. So my question right now is, the place of this premarital fertility testing, does it have any role to play at all? Or are we just doing it to fulfill all righteousness? And if it does, what are those tests that we can do that will give us a pointer to know that there's a problem somewhere that can be fixed or should be fixed before getting married?
Yeah, thank you very much, Dr. Pre. Let me just quickly add to the causes that something that we can do to prevent. A lot of guys these days wear tight trousers, very tight. As I said, that place needs air. It needs normal temperature. So by wearing all those tight jeans, skinny jeans, you are not giving good. You are heating up that place, and that can cause issue. Just to add that. Now let's come to the issue of premarital infertility testing. Personally, I'm not an advocate of testing prior to pregnancy, but prior to marriage, for reasons best known to me, in the sense that you may do all these tests, and then, as I said, 10% of couple everything is clean, but they cannot just achieve pregnancy. So those couple, when they tell you, say, nothing is wrong with me, or they can't achieve pregnancy. So, and then, therefore, premarital testing, the advantage that people say is that when you do it, it helps the couple to know and then start managing together. Like, they know that, this is what is wrong, this is what is wrong. They have an idea of what they can do immediately. And then by the time they get married, they start up doing what they need to be done. The aim is not actually for a couple to say, I will not marry this one, or I will not marry this one. No. The aim for propagator of premarital infertility testing is the fact that both of them will understand that this is where the issue is. Let's just quickly start early, as we are choosing to get married, to start looking for solutions to these things. And what's basically are the tests that can be done? As I told you, that hormonal imbalance is a main cause of infertility among women. And so a woman can check the hormone level, Like someone with polycystic ovarian syndrome can know early that, I have polycystic ovarian syndrome. And the funny thing is that it's the most treatable cause of infertility. So if a woman has polycystic ovarian syndrome, he knows early. I had a young lady who actually knew she has polycystic as a young lady, not even before marriage, a long time, because she saw that her menstruation was irregular, she was gaining weight, she had some little beards here and there. So when she came, she knew that she has polycystic ovarian syndrome, and then started treatment. Of course, the treatment then was not about the infertility, because she wasn't going to start being pregnant at that time. So it was just to attend to the menstrual irregularity and all those weight gain and all that. So immediately she got married, the attention directed to the infertility, and in the first year she got pregnant, and of course she has 3 kids now. So it's knowing early the problem and then attending to. So a woman can do hormonal assay, where she can check her hormone level. She can do a scan to check her ovaries. Then she can do HSG. For me, I would say that a woman should do HSG while she gets married. First, after the first year of having not been able to achieve pregnancy, she does HSG to know whether the tubes are open or whether they are closed. HSG means hysterosalpingogram. For the male, a man can do a scan, can just visit to check, do I have varicocele or not? Should do a scan to see whether he has varicocele. If he has varicocele, he can attend to it. Varicoceles are amenable to surgery. Surgeries can be done for it. A man too can do a sperm count to know, is my sperm adequate? Is it fine enough? Is it okay to achieve, to help a woman to get pregnant? Because you can actually have your sperm count may not be, the person's sperm count may not be adequate, and even if there is sperm there. So the man can do all those tests to have an idea of what is wrong and then what can be done. Now, as I said before, that people need not to be so scared of infertility, although the burden is very bad because of where we live. But most of these infertility issues are amenable to treatment. It's just that the cost is much. Yes, the cost is much, especially for women who has the tubes getting blocked. Such a person is to IVF, and so the cost is quite much. Those are the fears that people. But for hormone imbalance and some other things, is amenable to medical treatment, which people can know early and start attending to it early too.
What point in time should this couple go for IVF? Is it just immediately, let's not waste time, or should we try and visit this doctor, visit that doctor before now going for the IVF?
Yeah, thank you very much for that question. It's very, very pertinent. Once a couple know what is wrong, and it is not the one because when you visit a specialist, we tell you this one is amenable to medical. For instance, if a woman have PCOS, such a woman should not go for IVF now. Drugs are amenable to it, so it goes straight to medical treatment. If a woman has the two tubes blocked, it should not be bothered trying drugs or trying this, trying that. Some people will even suggest to them, come on, let's do surgery to open the tube, which is very difficult. It can even lead to the tube getting blocked again and all that. Man has oligospermia or aspermia, that's the sperm that has nothing at all. Such a man and the woman should go for IVF. If a woman has both tubes blocked, such a couple should go for IVF. They should not wait. And then if you have tried other options and then it didn't fail, 1 year, 2 years, go for IVF. IVF is not 100% certain, of course. It's about 30% success rate. But it's still a good chance for a couple to achieve pregnancy instead of wasting money. So people visit a lot of places, this, that, even traditional home, drink a lot of medication, herbal medicine, spend money here and there. Once you are sex and it's bilateral tubular blockage, I will tell you, go for IVF. If it is the man's sperm is inadequate, go for IVF. If the tubes, okay, I'm talking about tubes. If it is PCOS, we won't tell you to go for IVF. You shouldn't start saying, oh, I want to go for IVF straight. No. Then if it is no cost, like I said, that if there is no, there are 10% of couple that don't have a cost to their infertility. Such a couple, I would say that they should give themselves 2 years. 2 years. If you diagnose that, you are okay, this one is okay. Have adequate sexual intercourse 3 times a week. Give yourself 2 years. If it doesn't work, then go for IVF. So those are the things, those are the people I would say that they should go for IVF. There's no need wasting so much money around. And then when you want to go for IVF, please go to a credible place. Find out about the place before you go there. Then lots of people just wanting cheap IVF and collecting money, 800,000, this. Look for a credible place where you know about their success rates before you venture into that place. Don't say, okay, this one is cheaper. This one is 750,000. This one is 850,000. Let me try that. No. Look for a credible person who has been having good successes and go to that person.
For those who they have a child, first child, now trying to conceive again, there's a problem for them. They are worried. These people, they say, it's like I offended maybe my mother-in-law, somebody in the village that has now tied my womb. And we've heard that story before. The woman has given birth. Now she's finding it difficult to give birth again. How do we go about this? What could be the cause of that and how to address it?
Yeah, for people like that, they should first of all find out what's the reason, why are they not achieving pregnancy again? And then the focus should not be only on the woman. That a man was able to impregnate his wife in the first year doesn't mean that he can impregnate the wife in the next 2 years. So it's a couple thing. Subfertility, infertility is a couple thing and should always be a couple thing. So both of them should check where the issues are, and then when the issue is recognized, they should attend to the issue. Now, if the woman is above 40 years, I would say that the woman should visit, should go for IVF, not like IVF itself, but at least visit a center that has infertility treatment. Let them assess her properly, because by the time a woman is getting to 40 years, the eggs are not as quality as they should be. So such a couple, we have to visit such a center to assess them properly. So, because there may be something wrong, that you achieve pregnancy 1 year ago doesn't mean that you're going to achieve pregnancy the next 2 years. So, yeah, it should be something that we must have at the front of our mind.
Okay, at the front of our mind.
Yes, at the front of our minds.
Okay, Ma. Now this one is I'm particular about our lifestyle and infertility right now.